too small print, too long and too densely folded, full of incomprehensive terms and listing hair-raising side effects. The package insert leaflets of medicines. Allegedly every third patient feels insecure about these texts. Even an audit report of the European Commission comes to the conclusion that there is a significant need for improvement. Obviously it is a legal requirement that important information is always provided with the product. But is this done in the correct way? Uncle Takai's researched the double bind of package insert leaflets in more detail and was searching for solutions to solve these issues.
They come in various sizes and in different formats, but they all have the same problem: a huge amount of information, with very little space. To decipher all this, it often takes more than a pair of glasses. After all, people are strongly encouraged to carefully read the package insert leaflet and find out about risks and adverse reactions. But actually a survey found out that 4 out of 10 patients do not comprehend the information for use of their medicines. In addition, surveys prove that more than 80% of patients indeed carefully read the information, but around 30% then do not even take their medicine due to the information on adverse reactions.
This is indeed a tightrope walk. On the one hand, it is obvious that all adverse reactions are mentioned, even if they are very rare or even just theoretically possible. On the other hand, this creates anxieties among patients, and then the adherence is at risk, meaning if a doctor has prescribed a medicine, because the patient really needs it, but then does not dare taking it, and this is the worst case to happen, if patients do not adhere to their therapies, because they are too worried about what they have read in the information for use.
In the European Union, the criteria for a compliant package insert leaflet are regulated in detail. It must contain comprehensible and well-readable information, in the respective official language. It must list the properties of the medicine, as well as the fields of application, contraindications, safety precautions, the dosage and the adverse reactions.
For us this is very important. We have the requirement already for years. For every permit of every medicine that is newly brought into the market, any instruction for use, which a pharmaceutical company presents for approval has passed a readability test, meaning that it has actually been tested by patients. We would not allow the market entry of any product's information, unless there is proof that the text has been well understood by at least 20 patients coming from various demographic groups.
For our program we have made such a test, which checks the content and design in all detail.
I like the format.
I'd say yes.
I'd give the full score.
I find the script is easy to read.
Absolutely, I can read it, even without my glasses. For us, the text of the test object, a package insert leaflet for a homeopathic compound, was easy to understand.
At least 81% of the probings must be able to read the instructions and to find specific information in the text. If the result is below 81%, this is documented in our report and the companies must change this information.
Examples for failures are, too thin paper, making the print show through, or a too small font size, which also is legally regulated. The font size must be minimum 8 points, which equals less than 3 millimeters. The line spacing must be at least 3 millimeters.
Sometimes this is quite difficult, as often there is really a lot of text. And then these instructions for use become very big, very long and very voluminous, and you end up with a lot of paper.
To solve this problem, some pharmaceutical companies came up with solutions like this manageable little booklet for a popular gastric medicine. Thanks to the patient tests, well laid out indices have become a standard already. But what about visually impaired and blind people? All packages of medicines must carry the name of the product in Braille, the embossed tactile script. So far patients could only use a hotline of a call center, or a pharmacy to have someone read the information of the package insert leaflet to them. An expensive and time-consuming solution.
This means that a patient then must understand and remember what has been read to him over the phone. He cannot listen to the information 3 times in a row, to specific sections or again on the next day. He'd have to call again, which most people are shy of doing. In other words, for patients this is definitely not a pleasant and effective solution.
To comply with the EU regulation, which is in effect since January 1, 2016, information on all products of daily life must be accessible for all people. This company has a simple solution, the SpeechCode.
A SpeechCode is a color data code, which contains all information, in this case the entire information leaflet, in the code itself, to provide accessibility always and everywhere, and to guarantee the data privacy of the users. The code then is scanned with a smartphone app, which is available free of charge in the app stores, and the text is immediately read out aloud. As it works offline, the users do not need an internet connection and can avoid all risks and costs related to going online.
Amylin 1.5 milligrams. Chapter Overview. What is amylin and what is it used for? What you have to consider before taking amylin.
Easy to use, and people can listen to the entire information, or just specific sections anytime, as often as needed.